Hello, everyone. Welcome back to the Career Guidance Series US. I hope you're all having a wonderful day. My name is Luqman Siddiq, and I'm the coordinator of Alfaisal MedHub under the International Office at Alfaisal University, Riyadh, Saudi Arabia. I am honored to be your host for today. For those of you who don't know what Alfaisal MedHub is, Alfaisal MedHub is an initiative under the umbrella of the International Office College of Medicine that aims at creating an online global community of medical students. Alfaisal MedHub covers a broad range of topics that are common to medical students all around the world. Our primary objective here at Alfaisal MedHub is to help medical students learn more about the career opportunities available after graduating, as well as the steps involved in pursuing them. As you all are aware, the Career Guidance Series are conducted in partnership with AMBOSS. There is no doubt that the USMLE exams are a common fear among all medical students planning to apply to the United States residency programs, as it can be either a make or break of their future careers. Today, we are excited to bring to you a new webinar of the Career Guidance Series US titled Nailing the USMLE Step 2 CK Exam, which will be delivered by Dr. Abduljabar and Dr. Bakhshwin. Dr. Abduljabar and Dr. Bakhshwin are recent graduates of the College of Medicine at Alfaisal University. They both have scored more than 270 in the USMLE Step 2 CK exam. They enjoy mentoring their junior colleagues on exam preparation and solving strategies. Thank you so much, doctors, for taking the time from your schedules to give this webinar. You can start whenever you're ready, but before we start, I'd just like to clarify whether you'd be taking the questions from the audience as they come, or would you like to have the questions at the end?
Perfect. Thank you, Luqman. So I'll comment on that. Assalamu alaikum, everyone. This is Mohamad Alabdaljabar. And today, along with my colleague and great friend, Dr. Abdulaziz Bakhshwin, we'll be covering the Step 2 CK exam. So regarding the questions, I think it's better if we leave them till the end. If you haven't, or if you think that you might forget the questions, just write them down in the chat box and send them to us privately or in public, and then we'll make sure, inshallah, toward the end of the presentation to go over and answer each and every one of them. And I just noticed sometimes we might forget as speakers to answer any question. It's just not that we're ignoring them. Sometimes if two questions are sent at the same time, we might read the subsequent one. So just copy and paste again, and inshallah, we will answer it. So again, thank you, Luqman, for this great presentation, and thanks for the International Office and the MSA for this great opportunity. I'll start by sharing my slides. So I'll start, and then my colleague, Dr. Abdulaziz, will take over. Just 1 second. I think we can see the full presentation, right? Not the screen show mode.
Yes, the whole presentation.
I'll just try to. I think now it looks better, صح? It's only the first slide.
Yes.
Perfect. Thank you, Abdulaziz. So, Bismillah ar-Rahman ar-Rahim. So, as I was saying, inshallah, today we'll cover many aspects of Step 2 CK exam. So, we'll start off by talking about the importance of Step 2 CK. We'll cover some of the important data that we have from the NRMP about the importance of Step 2 CK exam, and the other factors that might influence your getting into the specialty of choice to train in the US, inshallah. Best time to take Step 2C exam, registration, preparation of the exam, and then we'll talk about the actual exam day. Yeah. So before we start, I always like to start with this slide, whether we're talking about Step 1 or Step 2 exam, because trust me, all of us who went through this process, we know it's a tough process. And I remember myself, before even doing Step 1 exam, I've seen one of the tweets. It was one of the tweets of my senior colleague and a friend when he was done with all of his 3 steps. It was such an impossible thing for me at that time, will I be able to finish all of the 3 steps? Because I know it's a tough process, and we have other things in life. So we have mid school, we have family, we have other commitments, and in medical school, whether it's extracurricular activities, research, and so on and so forth. So it is a challenging thing. But trust me, if you just try to make it as a continuous process, try to be consistent, and try to add things that you enjoy in your daily day-to-day life, it will make it a much better experience. So for Step 2C exam, it's a long exam and it's a tough process because it's full of questions. You're done with Step 1 most likely. So you're already tired by Step 1, whether you start to prepare for Step 2CK right after you're done with Step 1. So the best way is just try to adapt in your daily life on things that you enjoy. So for example, always try to have, let's say, at least half an hour or 1 hour of doing things that you like. And especially I know from Alfaisal community, most students take Step 2CK during their 4th and 5th year. So these 2 years are wonderful because we have the time, and then the lifestyle of 4th and 5th year are way better than 3rd year. So just try to make the most out of it on how to study for Step 2CK by doing things that you like. In addition, the other thing that most people who are done with Step 1 exam, they think that Step 2CK, the way we should study for Step 2CK has to be similar to the way that we studied for Step 1 exam. It might be correct, but for example, for me at least, it was different. At the beginning, I used the same technique for Step 1 exam and it was not working. Questions are longer. Many of the information that we study for Step 2CK exam are relatively newer. So that's why it's important, just try to experience another way of studying if you think that the previous way is boring or it's not working. The third thing, when you're trying to do questions, and especially for UWorld, because as you will see, UWorld will be one of the major tools for studying for Step 2CK exam, is try to do it in a way that you like. So for example, for me, I try to do questions most of the time while eating something that I like. So I'll prepare a small snack or something, and then I'll try to study. So these small things, when I'm looking at them retrospectively or now looking at the 4th and 5th year, they made a huge difference. We can't imagine how important these things are when we don't try them. But once you do, you'll see the difference. The other thing, try to change places if you like to do so. So for me, studying at the university in-house or sometimes in cafes helped me a lot to just change the whole background setting. So it is refreshing sometimes. So these are important things that you should consider to do when you're preparing for this exam. Now, going forward, we'll start off with the Step 2CK importance. Again, this is data just to show you the importance of Step 2CK in general. And all of the data that we have are taken from the NRMP 2021 match. So it's a recent data. So we'll start off with this slide. It shows the percentage of Step 1, Step 2CK, and Step 2 and other steps, and getting you an interview for all specialties. We'll talk about all specialties, but then I'll mainly focus on internal medicine. We have few slides on general surgery and pediatrics as well. So looking mainly at IMG applicants, you have the USMLE applicants data, you can look at them. But mainly for IMG applicants, if we're comparing steps on how important they are in getting you interviews, we can clearly see that Step 1 was the most important thing. The dark blue gives you a clue about the required target score. So 43 of programs have a required target score of Step 1 to give you an interview. 17, they had a preferred score, but it was not a requirement. So you'll not be filtered out based on a score. And then the other ones are either they do not consider Step 1 or they consider it as only pass or fail. Looking at Step 2CK, we can see that it's 37 compared to 43 as a target required score. But if you sum up 37, the required score and preferred score overall, you can see that it has a heavier weight than Step 1 score. And for us IMGs, requirement is a requirement. If you don't get the requirement, you'll be filtered out. But even preferred score, it is tricky for IMGs. Let's say, for example, for internal medicine, if the program has this year, at least, most of the programs has had around 4,000 applicants in total, IMGs and AMGs. But when programs have 4,000 applicants and you're talking about preferred score, to me personally and to other program directors' subjective point of view, they see preferred score as a filter for program directors. Because for IMG, let's say if anyone above, let's say 240 in Step 2CK is a preferred score. And above 240, let's say they have 2,000 applicants. Most likely now the preferred score is a requirement because they will not look into the first 2,000 applicants and then go to the not so preferred, the other 2,000 applicants to review each and every one of these applications. So from this slide, we can see that they're comparable, but the overall height for required and preferred score for Step 2CK was more important for all specialties. We will see the breakdown later on. Next, this slide shows you again a percentage now this was a survey sent to all program directors of different specialties. And again, it's 2021 NRMP official data. This slide shows you the educational academic performance characteristics as a percentage-wise. So it's not the mean importance. Next slide is about mean importance. And this is for all specialties. Again, looking at this slide, we can see that step 1 was the most frequently cited, not the most important. The most frequently cited among program directors in terms of which applicants we should interview. But again, even if you compare the percentages between step 1 and step 2 CK, we can see that step 1 is around 10% higher, but that's only in terms of frequency. Going next, this slide shows you the importance. I'm just trying to go back and forth, and I'm getting the admission, so it's covering part of the slide. Tamam. So now this slide shows you the importance of different parameters on which applicants we should interview. Again, this is the NRMP 2021 data, so it's way before, it was before the decision was made to make the USMLE Step 1 as pass and fail. And all of the applicants by this time, by 2021, none of them has a pass or fail. So looking at this slide, we can see that Step 2 CK, I think you can see my cursor, Step 2 CK score was already more important in deciding who to interview in terms of importance. The previous one was in terms of frequency. Going next, now these two slides will show you who to rank. So we have two things. When you apply to residency in the US, the first step is to get interviews. You'll do your interviews, and then programs will rank you, and you'll rank programs. So you have to pass two filters to get matched in a program. The first one, you need to get an interview, and then the second step is getting ranked highly by the program. So looking at this slide, again, it shows similar data. So step 1 and step 2 CK are almost comparable. This is for all specialties, but again, this is a percentage. So let's say if 100 programs are deciding which factors they will use, 61 of them thought step 1 would be the best indicator, whereas 60 in step 2 CK decided that this is what they'll be using to interview people. But next, when they try to put them in a scale from 1 to 5 in terms of importance, step 2 CK was slightly more important to decide who to rank. So we have two data, who to interview and who to rank. In terms of frequency, step 1 was more frequently used than step 2 CK. In terms of importance on who to interview and who to rank, step 2 CK was already more important. And now thinking about it, not only from my own point of view, but from other program directors' point of view, everyone expects that this trend will start to decline this year and subsequent years until we reach 2024, 2 years from now, because by that time, most of AMGs, American graduates, will not have a step 1 score, numerical score. So by that time, everyone expects step 2 CK to lead. And this is just a common sense because it makes full sense, because we don't have step 2 CS. Step 3 is not required for you to apply for residency. Step 1 will be pass or fail. So step 2 CK is gradually taking over. And again, looking at 2021 data, 2020 and 2019, the importance of step 2 CK was already a little bit higher than step 1. Now, going further, so I just added this slide. It's not directly related to step 2 CK topic, but just here to show you that there are other factors that are more important than step scores. So for example, this slide, again, is showing you the importance and whom to rank. So let's just go back one slide. Here we can see that the average is barely reaching 4 for most of the factors, whereas for this slide, it's related to applicant characteristics. Most of them are way above 4. So for example, interpersonal skills, interaction with faculty, resident, with staff during your interview, even if it was a virtual interview, these are very important to decide whether the program will rank you high or not. So steps will open the door for you. Once you reach the interview day, these are way important than your step scores, because they are looking at you as a person, whether you'll be able to fit in or not. Now, some data for internal medicine. I chose internal medicine because I know many of us are interested in internal medicine. And then the other thing, I'm personally more interested in it. And then the sample size we have is the largest. Speaking about sample size, the total number of program directors who answered the survey was only 124. the number of internal medicine programs in the US is more than 500. So it's just realistic to know that the number we have is only 1/5 of the actual number of programs. So just take these data with a grain of salt, because sometimes it might be a little bit different because we have the non-response bias. It's only 1/5 of the program directors who answered these questions. And we don't know whether this 1/5 is the upper 1/5 or the lower 1/5, or it's throughout different residency programs. Nonetheless, it's still helpful to get an idea. So again, now, if you remember the first slide that we showed, it was for all specialties. Step 1 was a little bit more important. Looking at internal medicine, and again, this is 2021, before anything is well known about pass and fail. Step 2 CK was more frequently cited than Step 1 for internal medicine applicants. So 57 compared to 55. We expect this trend to keep increasing, the importance of Step 2 CK to keep increasing until 2024, where Step 1, most likely, the score of it will not be as important. Having said that, Step 1, failing on Step 1 would be a red flag. Failing on Step 2 CK would be a red flag. So Step 1 might lose its importance as a numerical value, but failing one of these steps will be a red flag. So that's something really important for you guys to consider. Again, now we're showing similar slides in terms of the main headings, but for internal medicine. So looking at internal medicine, we can see now the trend is different and was different. Step 2 CK is or was more frequently cited or used as a factor to decide on who to interview. Step 2 CK was more important for internal medicine residency. I'm looking at the third line in here, 4 compared to 3.7. This is again for other parameters. Again, I just put it here for your reference if you want to have a look at other things that program director might use. Step 2 CK was more frequently used as a parameter to decide on who to interview for internal medicine applicants. And Step 2 CK was more important to decide on who to rank for internal medicine residency applicant. So the scenario is very important, because I remember when I finished my Step 1 and everyone around me was saying Step 1 is the single most important exam for you in your future career. This is correct. Step 1 is really important. I'm not trying to underestimate the importance of Step 1, but for internal medicine, it was not the case. This is 2021 data. I have 2020 data. It's exactly similar. Step 2 was more important for internal medicine residency applicants. For other specialties, it's different, and we'll see in a second. So I put a few slides about pediatrics and general surgery, just for your reference. So to decide on who to rank, the most frequently used factor was MSPE. MSPE was the most, and I think in all of them. Just for you who don't know what MSPE is, it's the Dean's Letter. It's really important, especially for American graduates, and these data are for both AMGs and IMGs. So that's why I see it as, it is important, but for IMGs, it is not as important as AMGs, because they don't know the level of our universities. Some universities might write similar letters without changing them much for their students. So that's why MSPE is not a very important factor for international graduates. For more standardized tests, Step 1 and Step 2 CK, that's why I was mainly focusing on these two. So this is for general surgery for our, one second. No, this is for PED. So program director, PEDS, and rank. That's how I knew it was for pediatrics. So for pediatrics, Step 1 was a little bit more frequently used as a parameter to rank people or applicants. And for GS, it's a similar trend. So Step 1 was a little bit more used to rank students or applicants in compared to Step 2 CK. Again, we expect this trend of Step 1 importance to gradually go down, and Step 2 CK to gradually take over until 2024. I think, yeah, so we're done with most of the NRMP data. This is, again, another piece of screenshot taken from NRMP. This is 2020 data. I know they publish these statistics about the mean Step 1 and Step 2 CK score for IMGs each other year. So looking at this, again, is very important just to set a realistic way of expectation for your score. Especially, I know, for example, at Alfaisal, we have very high level of expectation. And that's not realistic, because you don't need that high of a score to be able to succeed in the US. But it's nice to aim high, but even if you don't get the 270, 280, that's totally fine. You're still a star. So looking at Step 2 CK scores for non-US IMGs who matched, the mean or the average was 246. So around 50% of students had a score of less than 246, and they were still able to match in the US. And this is for general surgery. We have other, for each specialty there are scores, but I put general surgery purposely because this is one of the specialties that many IMGs apply for. By saying many, it's not as comparable to medicine or, for example, peds, but I mean many IMGs choose general surgery and it is competitive for them. It's, for example, internal medicine, pediatrics, neurology is not as competitive as GS for IMGs. So 246 is doable. And we're talking about the mean. So some applicants got below 246 and they were still able to match. For US IMG, it is comparable to 45. Again, this slide is just for your reference, 2020 data. Looking at different specialties with the mean average or with the mean score of step 2 CK for US IMGs and non-US IMGs. You see in the blue sign, it means that this sample, the applicants of this sample have matched. So you just try to plot it in, go see the average. But I would say if we draw a line at 240, it crosses most of the specialties, except I would say the really, really competitive ones. So orthopedic, neurosurgery, ophthalmology, and so on and so forth. Yeah. So now just an important disclaimer before we move on to how to prepare for the exam with my colleague Abdulaziz. These are just numbers. We are not just numbers. So it's important for us to just have a look and understand how important the exam is. But then again, in this presentation, I mainly focus on step 2 CK, but there are other important parameters for us to know. So if you have time, just Google NRMP March 2021 data. Inshallah, a few months from now, 2022 data will be available. These are important for us to understand based on what program directors are choosing to interview and to rank applicants. That's one. The second thing, everyone who sees my presentation would think that I really like step 2 CK because I scored better than step 1 and I hate step 1 exam. Actually, I don't like step 1 exam. I like step 2 CK just because it was more clinical. But then step 1 exam and how the amount of effort you put to prepare for step 1 exam is very important. So I know that step 1 exam, and at least I'm speaking about Alfaisal community because I am a graduate of Alfaisal. Mashallah, many students, their level of their knowledge level, the way they prepare, the resources that they use, I would say by the end of third year with the summer, if they finish first aid, at least finish 50% of U or get one MBME done and they pass it, I think they're good to pass the step 1 exam, and especially that we know that this week it was changed to pass and fail. But I wouldn't advise that students do so, because if they happen to just pass the exam and start to prepare for step 2 CK, they might be in trouble. For me, and I think even for Abdulaziz, because we happened to talk about this in the past, and for all of my friends who've done step 2 CK and excelled in it, everyone agreed, and the consensus is that the most important and most helpful resource to prepare for step 2 CK exam is step 1 exam. So if we just try to finish now step 1 exam and get into step 2 CK exam without fully understanding the concepts of step 1 exam and mastering its concepts, it will be a little bit tricky for us to excel in step 2 CK exam. So having said that, step 2 CK exam was already more important for internal medicine and is getting more important for all other specialties, this does not mean that we just finish step 1 as soon as we can and go to step 2 CK exam, because this might create a problem for us. So I think by that, we're done with the first part, importance of step 2 CK exam. Again, if you have any question, write them, we'll answer them at the end. Now, I'll give the mic to Abdulaziz so he can go next.
Thank you so much, Mohamad. Sarahatan, you gave us a lot of important insights and hidden information that many people may not be able to reach. Even if they reach to, they might not be able to read it as well as you did and explain it in such a beautiful way. Thank you for that. Okay, so I'll be talking about, inshallah, the preparation and assessment for step 2 CK. Just before I start, I want to emphasize the importance of step 1, as my colleague Mohamad said, the importance of step 1 in step 2 preparation. It's really the pillar of step 2 preparation is the knowledge that you gain from step 1. everything that you in step one, whether it's first aid, whether it's UWorld, whether it's videos, all of that information that you accumulate during that time will definitely help you when you prepare for step 2 CK. I didn't know about this trend that is being projected by the year 2024, as my colleague Mohamad highlighted. So probably by that year, the importance of step 2 CK will definitely be more important than step 1, and it will be a turning point for IMGs. So the focus will be on step 2 CK, and all of the fuss and all of the preparation, all of the pain and long hours of study will be dedicated to step 2 CK. So without further ado, let's dig into our topic here. So overview of the exam itself. The exam is composed of 8 blocks. Each block has 40 questions, except for 2 blocks. 2 blocks, they have 38 questions, and I'll tell you why in a minute. And it's a 9-hour exam. Okay, so 8 hours, so 1 hour for each block, and then 1 hour as a break. It mainly focuses on clinical knowledge more than basic concepts, although there are still basic concepts that will be asked about in step 2 exam, and it has a considerable amount of basic concepts actually. So that's why step 1 will help you in preparation, and also during the exam itself will help you in solving questions. So the preparation will be easier and shorter, of course, if you took step 1. So step 1 is really important in preparing for step 2 and making it easier and paving your way. This is one thing that I love about step 2 is that it has limited resources. Okay, so maybe 1 or 2 resources that you can focus on. Given that you finish step 1, this is very important. Given that you finish step 1, you will have limited resources to prepare for step 2. Unlike step 1, step 1 you have hundreds of resources that you can use to prepare. You have first aid, UWorld, you have Boards and Beyond, you have Anki, you have many things. Okay, but for step 2, the number of resources is very limited. We're going to talk about the resources as well. So why there are 2 blocks with 38 questions? Because these 2 blocks will have questions about research studies. So they'll give you a research study with the results and the conclusion and the and a brief overview of the study, like an abstract, and they'll ask you 2 to 3 questions about that research study. So these questions usually they take more time to solve and to read. So that's why they're being easy on us, so to speak, by giving us 2 less questions in the blocks which have these kind of questions, the research study questions. Okay. So a very common question that I get is, can I take step 2 before step 1? Definitely you can. There's nothing to stop you. There's no rule against that. Although I'm not sure if this rule is going to change with step 1 being pass fail, but as far as I know, until now, still you can take step 2 before step 1. So you don't have to take the exams in order. However, having said that, step 1 knowledge will definitely help you in preparing for step 2, and it's going to make it much easier. Even the amount of time that you'll have to dedicate for step 2 will be much less if you did your step 1 and you did it well, and you did it thoroughly. Many questions in step 2 exam are based on step 1 knowledge, so they're based on diagnosis. So and a lot of step 1 knowledge is basically they ask you about diagnosis. They give you a clinical scenario and then they ask you what's the diagnosis. And same thing in step 2. Although maybe with more information or with one or 2 tricks here or there, but the fact of the matter is that they're very similar when they ask about a diagnostic question. Many questions are related to microbiology and pharmacology, and these are mainly from step 1. They're not really step 2 material. So if you have them in the back of your mind, it's going to make your life much easier, and you're going to thank yourself for doing step 1 before step 2 and doing it well. So resources, UWorld, it's the most important resource. It's the primary resource. that essentially is the only one that really need for this exam. If you do it well, especially after finishing step 1, if you do your word well, step 2 is going to be a breeze. In terms of preparation, it's going to be very easy and very straightforward. Amboss QBank is amazing. It's very good. It has very good quality questions, similar to UWorld and even similar to the exam itself. Even their explanations are very good. They have an amazing library, very organized, even more organized than UWorld. Their organization is incredible. If you want to revise a certain topic, it would be a nightmare trying to look for that topic in UWorld. However, if you use Amboss, that topic is going to be summarized, in a very short, concise manner. All the information that you need will be in one place. Unlike in UWorld, where you have to, go back and forth between different questions in order to get the information that you need. Other resources: Online Merit, it's a video channel that mainly focuses on clinical knowledge. Maybe some of you know it. Anki flashcards. If you're a kind of student who uses flashcards to study and memorize, if that style of studying fits you and fits your personality and the way you do things, then it can be helpful. And first aid for step 2 is not recommended. I haven't seen a single examiner who took the exam who used step 2 to prepare for the exam. The first aid, I mean. So it's not that important. Probably maybe the least important in the list. So piece of advice: don't use it. So UWorld. So as I said, it's the primary resource for step 2 CK. It covers all the important topics and subjects that you will see in the exam. And the question style is similar to the real exam. Just like in step 1, the UWorld style is very similar to what you see in the real exam. Very representative in terms of difficulty even. So the difficulty, the length of the questions, the way they try to trick you is similar. Okay, so UWorld is a very good representation of the real exam. So it can be very helpful. So how to use it effectively? How can I use UWorld effectively? Mohamad, my colleague, mentioned that usually after doing step 1, you will be tired, you will be exhausted, you want to have a long break, you want to take things easy. Yeah, and it's understandable. Okay, so after taking your break from step 1 and having some fun and going back to reality and preparing for step 2, you should take it easy in the beginning. Do 1 block per day. Usually, I prefer doing blocks random timed, so random from different subjects and timed, because this will help me in practicing my time management during the exam. However, sometimes it can be helpful to do the questions based on subjects, especially for step 2, because many of the information is new. They're clinical information, asking you about management, asking you about risk factors, asking you about things that you haven't necessarily seen in medical school or in step 1. So for some topics, for example, for me, Obigani was kind of tough and it was kind of confusing. So I did that subject as by itself. I did not incorporate that subject into the blocks that I do randomly. So I did Obigani by itself, and then the other blocks, the other subjects, I did them randomly, and that helped a lot because I needed a good base in Obigani, and doing it that way helped me in regaining that base and building my knowledge. Revise the blocks, of course, after you solve the block. Revise it well, especially your incorrect answers. Revise them very well. Use other resources if you need to. Maybe you can use a video channel, or you can go back to step 1, the first aid for step 1, and revise some topics that showed that might show in the exam. Use flashcards for tables and diagrams. So UWorld has a feature where you can add flashcards, and you can add the diagrams and the tables in UWorld to these flashcards. And I find it very helpful, to be honest, using this trick. So I used to add the tables and diagrams that I see in different questions to flashcards. And then by the end of the block that I do, I used to revise these flashcards. Okay, so I revised all the tables and the diagrams which were present in the explanation part of UWorld. So I revised the tables and diagrams, and then I also revised them on a regular basis, maybe like every week or every 2 weeks. I used to revise these tables and diagrams. So by the end of my preparation, by the end of my first pass, I had more than 1,000 flashcards, and because I used to revise them on a regular basis, most of them I memorized because I saw them more than 5-6 times already. So and it was very good, a very good way of consolidating the knowledge that you gain from UWorld, because UWorld, you solve a question, you read the explanation, you might not get back to that question again, or you might think that the question is relatively easy and the information there is relatively easy. You might forget that information, but if you put it in a flashcard on a table or a diagram, and then go back to it later and revise it on a regular basis, it's going to help you to make sure that you retain that knowledge. I used to have a separate Word document where I used to put anything I see in UWorld that has like initial diagnostic test, or the gold standard for diagnosis, or this is the initial treatment for this disease, or the most important risk factor for this disease. Whenever I see that sentence in UWorld, I put that in a Word document and see that Word document again, and I revise it on a regular basis, and that helped me a lot as well. How many times should someone do UWorld? Again, this depends from person to another, depends on how thoroughly you've done your first pass. But for me, 1 time was enough. I did UWorld 1 time, and then I did it again maybe around 25% of it. But of course, a second pass will definitely help, especially if you do it very close to the exam. I did my my second pass, which was not a complete second pass. It was I finished only like 25%. I did it maybe 10 days before my exam, and it helped me tremendously, in refreshing some of the information that I forgot. So that trick or that strategy, it could be helpful to some people. So do not focus too much. This is do not. So do not focus too much on your average. Try to learn, not to assess your knowledge. Okay. So we say this again and again. UWorld and MBMEs and all these things that have a numerical score attached to them, they are not to assess you, especially if you are still in the preparation phase. Don't be hard on yourself. Don't feel bad if you score, for example, a 50% on a block on UWorld, or 40%. It's fine. It's totally fine. You're learning. Okay. These mistakes that you've made today, you will learn from them, and inshallah, when they come and they show up in the real exam, you will answer them, and you'll be thankful that you got them wrong in UWorld. Otherwise, you wouldn't have learned them, and maybe you could have just guessed that question and got it right in UWorld, but the same question shows up again in the real exam in a different way, and you'll not be able to answer it because you guessed it in UWorld, and you were happy that you got a higher average on UWorld. But the fact of the matter is that you did not learn. You did not use UWorld as a learning tool, which is the way it's supposed to be. Okay, moving on to AMBOSS. As I mentioned, it's an excellent question bank for practice. Maybe it's not ideal for an ideal tool for learning and building your base, your knowledge, because it's a lot. They have a huge number of topics that they cover, and if you try to go over all of them, it's going to take you forever. So you can do like targeted study of specific topics that you need to refresh your memory, or certain pieces of information that you forgot, that you can go back to AMBOSS and revise them. It's very well organized. As I said before, they have a library which is very well organized, and even better than UWorld in terms of organization. When you do AMBOSS, you will see that they have a a difficulty level for the questions, and the difficulty goes from 1 hammer to 5 hammers. 1 hammer is the easiest, 5 hammer is the hardest. Usually with the 5 hammer questions, they're very, very difficult, and they're gonna just make you feel bad about yourself if you get them wrong. So just try to ignore them. Maybe you can solve them, and if you get them right, you will feel better about yourself. But they're not very important because they're, believe me, they're beyond the scope of the exam. They're very, very detailed. Try to solve as much questions as you can in a short period of time. This is the way I did it. So I took a break from UWorld for about like 2 or 3 weeks, and I solved around maybe half of the question bank in Amboss. So that's around maybe 1,400, 1,500 questions. So I used to do maybe 100, 200 questions per day, and I just revise them very quickly. I don't read the experiences in details. I just try to move quickly so I can solve as much as I can. Again, you can transfer important points to a Word document, and this is what I did, and then I revised that Word document. First aid for Step 2 CK, uncommonly used. As I said, I did not see a single test taker who told me that he used the first aid book and he actually liked it or he benefited from it. If you need a textbook, use first aid. To be honest, first aid for Step 1. It has more important things to revise. As I said, Step 2 CK exam will still contain some basic information like microbiology or pharmacology or immunology. So you will be better off revising these topics than going to first aid for Step 2 CK and studying from it. So go back to first aid for Step 1, revise, some basic topics, use your time well, don't waste it on Step 2 CK first aid. Anki, so there are Anki decks for UWorld questions. Okay, so they take UWorld questions and they make Anki decks out of them. This might ruin UWorld for you. So if you did this before doing UWorld, by the time you get to UWorld, you'll answer all the questions correctly because you've already seen them in Anki. So this might be, you can do it alongside UWorld or maybe after finishing the first pass as a kind of revision of UWorld. It's excellent if you like using flashcards. If this is your study style, go for it. But it's not a must, of course. Other resources, Online Meded. It's a video channel. It can give you a good general overview of different subjects. For example, I use it for OB-GYN because my knowledge of OB-GYN was I needed to refresh my memory, and the way maybe we were taught in university wasn't the best. So by doing Online Meded, I rebuilt my basic knowledge about OB-GYN, and by the time I got to UWorld again, I did OB-GYN by itself, and that helped me a lot in solving OB-GYN questions in the exam and regaining my confidence in that particular subject. Podcasts. There is a podcast called Divine Intervention. I think maybe you can find them on Reddit pages or something. I'm not really sure. And also you can find Word documents. They make Word documents out of these podcasts, and they put in these Word documents important points that they mentioned in these podcasts. For example, they put risk factors, important diagnostic information, gold standard diagnostic studies. You can listen. The good thing about them is that you can listen to them while commuting, maybe while going to university or while coming back. I haven't used them, but I know people who use them, and they said they're very good. And it's a good revision towards the end of your preparation before the exam. You can use them as a way of wrapping up your knowledge and making sure that you don't miss these maybe small details, but significant when it comes to the exam. Assessment. How would you assess yourself after doing UWorld and your exam is near, and you want to make sure that you're on the right track? For Step 1, MBMEs were somewhat important, not really important, but they were somewhat important. For Step 2, they're not important at all. I solved only one MBME during my preparation, and it was useless, to be honest. It is not representative of the exam. The questions are not similar to the exam whatsoever. They're very short. They don't give you enough clues. And of course, there is no explanation in MBMEs. So when you do them, okay, you will know that you got the question wrong, but you will not know why is it wrong. So you have to look for the answer by yourself. So it's a waste of time and money. So don't try to do them. And of course, at the end of the day, it's up to you. If you need more practice, they might be a good way to practice. But me and all of the people I know who took the exam and did very well in the exam, they did not even purchase one MBME. UWorld assessments, they're the best. They're very representative of the exam, as in step 1, and they have explanations with them. So you'll be able to know why you get the questions wrong. You'll be able to revise your knowledge again. Free 120, it gives a good representation of the exam. You can use that again before the exam, maybe the week before the exam. So a suggested way of doing this or timing for doing this, you can do UWorld assessment 1, maybe after your first pass of UWorld, and then you can do UWorld's assessment 2 and free 120, before the exam, as a way to wrap up and as a way to practice as well. Maybe you can do them, together on the same day, because UWorld assessment 2, it has 4 blocks and free 120 has 3 blocks, so that's a total of 7 blocks. So if you do them in one day, in one setting, it can help in giving you a bit of a feeling of how long the exam is going to be. It's going to give you a feeling about when you should take breaks and that kind of thing. So lastly, registration for the exam. You go through the ECFMG website. Of course, you have to register. First of all, you have to register in the ECFMG website. The initial registration, where they give you a number, a USMLE number, and after that you go to their IWO website and you fill in the initial application. You pay $150 initially for the notary cam process. After you do the notary cam and you get certified by notary cam, then you'll be able to register for USMLE exams, whether step 1 or step 2. So after you do that initial process, you go to this website, you complete the application for step 2 CK, you pay the fee, it's around $1,200, and then you wait for your permit. After you get your permit, you can schedule your exam through Permitric. It's a very straightforward process. And that's it for questions. As we said, we'll keep them at the end. The mic back to my colleague Mohamad for the last part of this presentation.
Tamam. Thank you so much, Abdulaziz. MashaAllah, it was a wonderful talk. It's always nice to listen to you explaining, whether it's academic related or other stuff. MashaAllah, and I totally agree. For us, the next thing that we'll do, we'll talk about step 1 exam. But before, not step 1, step 2, I mean the exam itself. But before we do that, mashallah, you guys are asking wonderful questions. So keep them coming, because sometimes at the end of the session or towards the end, you might had a question and you might forget what was it. So just keep them coming, whether on public or directly to me or Abdulaziz. This is one thing. The other things that I wanted to highlight is that, mashallah, Abdulaziz, he presented his way of studying and it was perfect, sarah, mashallah, for him. And I totally agree with it. Like, I would say it was 90% similar to him. But for you, for example, let's say if you're done with step 1 exam, or if you think that doing AMBOS you don't have time for that. So for example, you're graduating, you're planning to go for electives and so on and so forth. Is it a must that you do AMBOS? I would say the answer is no. It's really helpful for me. It was really helpful. I used it, but some of our colleagues did not use it and they scored well above 260, which is perfect. That's something important. And it's not only about AMBOS. Even if you haven't taken your step 1 exam, it's full of resources. You don't have to finish all of the resources to take the exam. So always, it's really good and nice to hear other people feedback about the exams or other stuff in life. That's how life goes. It's important to ask people, but at the end of the day, it's your life, and you better know, you know your life circumstances and everything else better than anybody else. So always try to hear and listen, but at the end of the day, evaluate and think, is this the best thing for me? In step 2 CK, while you're preparing for it, it's really nice if you experience things and then try to adapt them or maybe replace them with other things. And the third point that I wanted to mention, which Sarah, alhamdulillah, was a big difference for me when studying for step 1. I used it, the first time I used it was in step 2 CK, and I used it for step 3. And alhamdulillah, it was perfect, Sarah. I'm not a big fan of writing notes. In step 1, I was totally against it, and I'm still against it. I know some of my colleagues are on the contrary, and they are big fans of writing notes. For step 1, I did not like it, and I did not do it. And I, alhamdulillah, do not regret not doing it. But for step 2 CK, writing notes was extremely helpful, and it was not from the beginning of my preparation phase. So I finished UWord, but then when I did not do a full second pass or part second pass of UWord. I only repeated my flags and mistakes. And when I repeated my flags and mistakes, I started taking notes on the computer. Abdulaziz mentioned this on a Word document. I also did, and it was bullet points. So 1 or 2 lines maximum. I did not want them to be too long. And then it's not only about taking notes. So because I know this from medical school, at least for speaking about myself, I used to take notes, but then never get the time to study them back again. So for step 2 CK, I used to take notes, 1 or 2 liner at maximum. And then the notes that I take, I send them to my phone. So one of the most helpful things for me is that I used to take the time, for example, when we're in clinics or rotating or we have a break, a lunch break, I would get my phone and then my small group of friends, it was the first month of internship in Riyadh, and it was at SMC. So I had a group of 6 or 7 doing pediatrics with me, and none of them was preparing for step 2 CK. So you don't have to have the group next to you. They shouldn't. It's not a must that they're preparing for their step 2 CK exam. Each one has his own exam, his or her own exam. So step 1, USMLE, other people are preparing for PLABs, and some are not preparing for any exam. But the knowledge that we ask is really important for us as a medical practitioner. So I remember, for example, what's the first line treatment for UTI? They'll tell me this, this, and that. But then I'll tell them if patient is pregnant, they'll tell me this. But then these are one-liner questions. It's really refreshing for me, and it was not something, I was not a burden on my friends, at least I hope, but they were really enjoying it. Yani, even at the times, they would be the ones who would ask me, you know, Mohamad, open your phone and start asking us questions. And it's only for 15 to half an hour. But this 15 to half an hour on daily basis, because each day we have to go to the hospital, would make the difference. And Sarah, it made a huge difference, in my opinion, in my step 2 CK and step 3 preparation. Going next, I'll be talking about step 2 CK, the exam itself. Perfect. But before that, I have one slide that I just wanted to share with you. 1 second. Yeah. So best time to take step 2 CK exam. This question is really common, and it's a really important question. So to me, I wouldn't tell you a specific time point in your life, and then this would be the best time point. Always think about 3 things. Your step 1 exam, again, it's not a must to take step 1 before step 2 CK, but in my modest opinion, I think it's really important to help you in studying. And then the other thing that some people would argue against taking step they'll argue against, again, taking step 1 before step 2 CK. They'll tell you, you know, most of us are in 4th and 5th year, and it's clinical knowledge, so it's easier for us to go in parallel with clinical knowledge. I agree, that's partially correct, but then the bulk of step 2 questions is based on step 1. So let's say if you forgot the basics of these antibiotics and they're specific for this disease, you might know the management of this disease, but the question in step 2 CK, they will not tell you the disease. They'll ask you, they'll put all of the basics, you have to conclude what the disease is, and then you'll choose the management. So, at least how our curriculum is, you know, in clinical years, they're really helpful, but then they're mainly focused on clinical data. So the questions, at least for us, were, you know, patient has rheumatoid arthritis, how would you treat them if they have extensive joint involvement? So they already give you the disease. But if they tell you, for example, let's say that the patient has these antibodies, not antibiotic, antibodies, and you're not sure, what would you diagnose them with? Is it rheumatoid arthritis or seronegative rheumatoid arthritis? And you're not sure about that, for sure, or most likely you'll get the management wrong. So that's one thing. The other thing, so this is how you decide the best time to take your Step 2C exam, whether you're done with Step 1 exam. The second thing I would strongly recommend, don't start preparing for Step 2 CK exam right after Step 1. Take a break if you can. I know for some people it might be a really tight schedule, you're done with Step 1 exam and the match starts by July, the year that you're in. So you need to start preparing and then take your Step 2 CK exam. That's understandable. But if you can, let's say for students who are attending in fourth year mainly, just try to plan it this way. Finish Step 1, 1 month break or so. I did 1 month break, and then start gradually with Step 2 CK exam. Once you're done with Step 2 CK exam, book your, or not once you're done with Step 2 CK exam, once you're half through your ward, just try to decide on a date and book it. Later on, you can change. The eligibility period gives you a 3-month time. So I think this would be enough to go back and forth and change dates. That's one. And then the other thing, you can calculate it, because as Abdulaziz was mentioning, Step 2 CK, you have a limited number of resources. It's not like Step 1, you have plenty full of resources, many books, online resources, UWard, and other question banks. Step 2 CK, the main two things are first, Step 1 knowledge and UWard. So UWard is the main thing. So simple calculation. Let's say if you want to do 3 questions a day, and yeah, I don't know what, but yeah. So anyhow, so let's say you're planning to do 30 questions a day. You have the UWard question bank, see the total amount of questions, divide them by 3. And I always like to give myself 15-day, half a month margin. So by this time, you'll get a realistic estimation of how long it will take you to finish UWard. If you finish UWard once, that's perfect. Then I would say put extra 1,000 for your flags and mistakes if you have time. If you don't have time, you don't have to repeat your flags and mistakes, although it's recommended. By doing this rough estimation or calculation, you will get a pretty good understanding of how long it will take you to finish preparing for Step 2 CK exam. So realistic number of questions. I just said 30, 40 is doable, but put 30 because this will give you a good margin. Add 10 to 15 days. And then book your exam, not the exam, I mean, book at least the eligibility period. Let's say if you expect you will be done by next May, always put the first month, the month that you expect to be done with, as the first month. Don't put it as April, May, June if you expect to finish in May. Give yourself time, put May, June, July. And some people will tell you, no, I want to put it as May, so I have to force myself to finish by that time. In my opinion, that's not the best way to do it. I know you don't want to force yourself by mentally by mentally stressing yourself since the beginning of your preparation period. So that's very important. And the third thing that we would add to best, how to estimate your time of Step 2 CK, just try to plan accordingly on what's next. So if you plan to finish Step 2 CK to work on a research project, go for electives, that's totally different if you plan to finish your Step 2 CK just to be able to apply to residency. Because research and electives are really important, but if you lose them, you will still, inshallah, be able to apply. And for example, for non-competitive specialties, you will be able, inshallah, to get interviews, given that other parts of your CV are okay. But let's say if you're planning to apply for residency, you can't miss the deadline. People who apply the first day, programs check applications, usually this year was mid-September, are really different from people who apply mid-October or mid-November, because there's no deadline, but programs usually start to look at applications at one point of time, and then it's less likely that they will keep reviewing any applicant who applied thereafter. So just try to look, why are you trying to finish? It's important to finish it as soon as you can, but ask yourself the question of, why am I trying to finish it this time? If I can extend a little bit, will I be more mentally free, less stressed, and I will not miss any important thing that I wanted to do? And these do not have to be only academic. So if you're planning to getting married, to travel with your family, to go on a vacation with friends, these are also important, but just try to realistically know what's next, and this can be delayed if I need to, or it's a strict deadline like residency, for example. And then even speaking about residency, if you think that Step 1 was really bad and you're planning to do Step 2 CK exam, and by saying really bad, it's up to your expectations and standards. It's a big discussion, but you decide on yourself. If you are not really satisfied with your Step 1 score, chances are maybe something went defective with Step 1 preparation. You don't want to be repeating the same mistake with Step 2 CK and end up messing up your whole application. So then it might be reasonable to not apply this year again, it's difficult sometimes to take this decision, seeing your peers and colleagues. But subhanAllah, sometimes it's for the best of your outcome. So, because this year will give you chances to relax, maybe do step 2 CK efficiently and get a good score, and then focus on other things in life, the things that we mentioned, whether academic or non-academic. So these are my 2 cents on best time to take step 2 CK. Now, step 2 CK exam. So for the exam, I like to talk about it before the exam day, and after the exam. That's how I like to tackle this this issue. So for before the exam, these are very general advices, but they're really important. Whether it's for your step 1, step 2, step 3, other steps in life, or even for other board exams. Because these are really important. So before all of these 4 advices, I would say last week of your preparation, just have something in mind that you want to study. Because some people will have, it's nice if you have your work, but decide on something that you want to do. Because if you stop not doing anything the week before the exam, that is bad, because you will be stressing about the exam. You don't have anything to do. You'll not be able to enjoy your life the week before the exam, because you're mentally stressed. You can't go out with family and friends. You can't watch your favorite series because you're stressed from the inside. And at the same time, you don't want not to have any plan in mind. And then the last week comes and then you want to revise everything. That's a problem. So just try to have your schedule, decreasing in amount as you approach the week of the exam. The week of the exam, you should be reviewing few things, not too many things, but at the same time, not sitting doing nothing. So maybe something that's reasonable, I would say, as Abdulaziz mentioned, your self-assessment 2, free 120. Do you have to do them on the same day? My answer is no, I did not do them on the same day. I did not do them on the same day for my step 1. And some people will tell you, little bit will prepare you for the stamina and so on and so forth. For me, I did not want to stress myself, and things went, alhamdulillah, fine. So prepare for something to review. I did I did only free 120. Your self-assessment 2, I did it before, like 2 weeks before the exam. So the 1 week before the exam, it was mainly free 120. And then the notes that I had, I also reviewed the pharmacology from first aid. It was a little bit helpful, I'd say, but it was not any game changer. The other things, I know that most of you or all of you know these steps. These are really important. Sleep well does not only entail sleeping well. I know we know this concept from our parents that we have to sleep well before any important thing. But sleeping well entails also preparing yourself as you approach the exam day. Let's say 1 week or 2 weeks before the exam, if you're sleeping at 4 a.m. because you're studying, and I'm a night also, I like to sleep late at night and wake up a little bit late also. So sleeping well entails, you should start to prepare your sleeping schedule to match the exam day. So the week or week and a half before the exams, make sure that you're sleeping well. Wake early, because sometimes if you have a week vacation before the exam day, if you got from the hospital or the university, you might be waking a little bit late, let's say 11 or 12. That's a little bit late for the exam sake. I sometimes wake later than that, but for the exam sake, it's important. Let's say aim for 9 or 10, or even before. That's perfect. The second thing, just try not to stress yourself out towards the end of the day. So if you're trying to study more at the end of the day, for sure, this will not allow you to sleep tight at night. So it's not a sleep well advice that is the end of the story. It's how to prepare to sleep well before the day of the exam, because it's a normal thing that we stress out before the exam, and it gets difficult for us to sleep well. Try to avoid any beverages that would wake you awake at night, coffee, Red Bull, and energy drinks, because these will interfere with your exam pattern as you go through that week. Do not overwhelm yourself with studying. As I was telling you, just make it a trend towards the last 1 week of the exam. It goes down. It doesn't reach 0, but at the same time, you have something to study for, but not to overwhelm yourself. The day of the exam, light breakfast. Many of us don't like to eat anything in the morning, but just try to have light something. So a cup of coffee and maybe a small sandwich, banana or something. That's really important. And think about how to divide your breaks. For step 1, it was not a very important thing, although it's something nice to do. For step 2 CK, it's really important. And as we'll see, the exam is really long and the question stems are really long. So just try to have a basic understanding. Are you the type of a person who prefers to go on a break after each block? if you are that type of person, that's perfect. Not perfect, but that's, I mean, okay, if you're the type of person who likes to take blocks in pairs and then go after, that's perfect. Again, not perfect, that's okay. So for me personally, I always liked with all of my steps, I always, because when I start my day, I think I have all of the energy of the day. So the way I did it for all of the steps, 2 blocks, but then a break. So 2 blocks, then a break. Then after each block, I took a break. And then not only that, I think is important to think about, but also how long each break should last for. So for example, for me, I had 2 breaks that I decided they will be the longest after the 4th and 5th blocks. After the 4th block, I decided that I will have my main breakfast meal. It was a small sandwich, iced coffee, and a small banana. And then after the 2nd break, I had in mind, I will need to go to the bathroom, have wudu and pray dhuhr, because in step 2 CK you have to pray dhuhr in the exam, otherwise you'll miss the salah, because it's really a 9-hour exam. So just this understanding will allow you to better understand how you want to divide your breaks. And again, going in breaks is really important. Even the things that you want to do in breaks are important with step 2 CK. So for example, for me, it's funny when people at least not knew about this, but saw it themselves. In one of the breaks, I started doing push-ups. It was summertime. For some reason, summertime, but I was really cold. And I felt that towards the end of the exam, I started to get more sleepy. So what I did, I started to do some push-ups. Again, walking briskly is important. Trying to train your eyes, look at your fingers and then focus for 5 seconds and then move them for the muscles of the eyes are important. So just try to think about not just going out of the exam and sit and just stare in the wall. That isn't helpful. And then the other thing that I would advise during the breaks, don't try to study or revise things. Some people tell me, I might get to read the information that's coming in the next block. That might be correct, but what are the odds? So chances are you will see a mistake that you did, and you'll get you start to think negatively about the rest of the exam. So my advice, don't do it from a phone, from your first aid, or even if you're getting the exam or giving the exam with a friend or colleague, don't ask them until you finish the exam, then that's a different story. So the exam day itself, time is the single most important factor during the exam. In step 1 exam, people who have taken step 1 exam, it is important. Step 3, it is important, but step 2 CK, it is the most important things for 2 reasons. The first reason, step 2 CK is the longest in terms of full duration. Step 3 is a 2-day exam, so it's not as step 2 in terms of full duration. The second thing, questions are really long. And for me, in step 2 CK, all of the blocks, I finished the term with my last question. I did not have extra time to review, go back to my flags and mistakes, maybe except in one block. Other friends and colleagues of mine, they had extra 2 to 5 minutes. So it is possible that you might have extra time, but time in general for step 2 CK is the single most important factor. So just try to train yourself. And it's funny that throughout my U-Word, step 1, I did it random and time mode. In step 2 CK, I did it random and I did the full U-Word first time as non-timed. So this was a challenge for me because most of the time I used to take my time thinking about questions during my preparation phase. I prepared myself for time management a little bit with the U-Word self-assessment 1 and 2, but with the real exam, it is exhausting because questions are long, your eyes will get tired, and then it's not 1 or 2 blocks that you need to just focus and keep going. It's 8-block, 9-hour exam. So just try to make sure that you have time management in mind, because in step 1 and step 3, they were not as significant as it is in step 2 CK. The other things, I guess you guys know them. Even if you don't, you'll get an email. So just make sure you have them. ID, your name should match your exam permit. If not, try to contact them. Font size, I know it sounds obvious, but it's really important because many of my friends who took the exam, and some of them I remember even with step 3, did not know about this. Font size, usually it's what you'll find in the exam, it's the smallest. So I would advise you put it on the middle, medium size. You have 3 options: small, medium, large. Large is too large. So medium size would be great because you don't want your eyes to get tired. Small, it was convenient for me. It's not that I couldn't read it, but because most of the question stems are long. So it's really, at least for me, and even for my friends who tried it this way, medium size in your exam day will make the difference. And it's important to mention this because many people will not notice, we need to change the font, especially that the U-Word and U-Word self-assessment 1 and 2 font is reasonable. For the exam day, at least for me, it seemed really small. Food supply, even if you don't like to eat, have few things to eat. Don't over drink water because you don't want to be going back and forth to the bathroom. This takes time. Panadol or ibuprofen, anything. Alhamdulillah, I did not need to use it in neither of my steps, but always have Panadol in pocket. Eye droplets, that's very important. I used to use them, so these are important. Get a jacket even if you're during the summertime, because sometimes it's cold inside of the examination room. And the trick for the jacket, once you take it, leave it inside of the examination room, because each time you go for a break and come back, they will vet you. So the jacket has extra pockets, so they need to see each one of these pockets. So this might take a little bit more time. So take the jacket with you. Once you go in, each time you go for a break, leave the jacket and go out. Mask, I know this is obvious, but my comment about the mask, take something that's comfortable. To me, the most irritating thing is whether it's on an exam, on a plane, or any time that I wear a mask for a long period of time, my ears start hurting from the sides because of the mask, even if I get a really loose one. So the trick for me, and Saraha, alhamdulillah, it was a life changer. I got the tieable mask, the one that we can tie. This one was perfect because it was not compressing on my ears. I can adjust how tight I want the mask to be, and so on and so forth. So that's important. If you try to get your nose out, they'll see you on the camera and they'll keep disturbing you. So don't do that. You don't want to be in the middle of the question and someone comes to you and tell you, put the mask on. And then you have to start from the beginning. So that's not advisable. Last thing, praying mat, at least for people who take the exam in Riyadh, Saudi Arabia, there's a space to pray in the ground floor. If you have your own mat, you'll just put it in the same floor and pray and leave. So for COVID reasons, that's advisable. Apart from COVID, I took it before. Oh no, I did it in COVID. But it was really convenient for me just to put my mat wherever I was next to my bag, pray, and then put it back again, just to save time. Exam day. So again, this is what Abdulaziz has mentioned. Few things. It's a 9-hour exam, 116 questions, 8 blocks, 1 hour each. So in 2 blocks, we have 38 questions, as Abdulaziz mentioned. There, you'll have abstract questions. And if you don't know what abstract questions are, it's fine. You'll see them in your word and your self-assessment 1 and 2. You'll have 45-minute break. This is very important, 15-minute tutorial. If you skip them, it will be added to your break time. So you'll have a total of 1 hour. And that's really important. Now, the tutorial is important. So what you can do before 1 week before your exam, you will go to Free 120 website. You can see the exact same tutorial in home. So make sure you go through it. Just don't skip and ignore it when you're in your home. During the exam day, the clock will start ticking. So you'll have 15 minutes. Skip it. It will be added to your break time. And that would be wonderful because you're in your step 2 CK. Break time is really very important. And for me, I used it all in my step 2 CK exam. So 60 block, 40 questions, 2 block, 38 abstract questions. This is very important. Again, flags and answer all questions. So in step 1, I used to flag, go back, review, and decide to change my answer. Step 2 CK, 2 things. Don't try to flag anything that, even if you have slight doubt on it. My advice, it's a personal opinion. In step 2 CK exam, try not to go over 7 questions if you're planning to flag. I never flagged more than 5 questions, not because I was confident. It was a really difficult exam, and as an exam, it was, to me, more challenging than step 1. But I used to stick to 5 at maximum because I know I will not have time to go back and forth, and I did not want to mentally or subconsciously stress myself out, seeing the left screen has 10 questions flagged, and I know that I not have time to go and read and decide and think about each one of these things. So 5 was my maximum. And then the other question, don't leave questions and go back to them. In step 1, I had the total opposite rule. Alhamdulillah, it worked perfectly fine with me. Any question that I thought I might be wasting more time because the concept was not that clear, I used to leave it empty and come towards the end of the exam and try to think about it. And this used to help. In step 2 CK exam, I would Sorry for that. I don't know what happened. Found ourselves outside of Zoom, and then now I'm back. Did it happen for everyone, or?
Doctor, I think you might have got disconnected.
Okay. So that's fine. But I think I will, so host disabled screen sharing. I can't share my screen. But I think I can keep talking about the same thing because this was the last thing that I wanted to cover. And no, chances are if you leave your questions and don't try to answer them, you might not have the time to go back and answer every single question. So at least even if you do an educated guess and try to go back to this question at the end, this would be way more beneficial than leaving a question and coming back to try to see what was the problem. And sometimes you might not have even the time to click on any answer. So don't do it.
By the way, Doctor, you can screen share now.
Thank you, Ala. Yeah, so this will be my last slide. So I'll just screen because I made it. So it's nice to see. Once you're done with the exam, congratulations, Alf Mabruk. You're done and you're a star regardless, because I know what it takes to finish these exams. It's really stressful, and I would say we don't have data to support this, but I would say 100% of applicants or of students who get to finish the exam, they did whatever they could to finish these exams. So never underestimate anybody's efforts, including yourself. And this is the most important thing. Do not underestimate the efforts that you did. The other thing now you can do, just try to gradually relax. Step 2 CK exam, the nice thing about it, unlike step 1, you can't compare and try to know what did you get right or wrong, because most of the questions are too clinical. So it's not Google or first aid that will give you the answer most of the time. And then now try to focus on what's the next step. So are you planning to do research? Are you planning to go for electives? The coming 2 to 3 week period, you should start gradually to feel stress-free, and then plan what's the next step is. Even if the next step is just to relax and hang out with friends or travel, then do them. Don't just set for the coming 2 to 3 weeks just waiting for your score. And then I would say after step 2 CK exam is the best time to focus on other academic stuff. Research. If you have some projects that are going, just try to finish them. If you haven't started any project, it's a perfect time to start, even if you think that you'll not publish by the time you apply for residency. Other thing, clinical elective, that's a perfect time because you're literally duty-free. You're done with your first 2 steps that allow you to apply for residency. Go for electives, do things that you like, and so on and so forth. And I think by that, alhamdulillah, we're done. So now we'll take questions, but I have one bad news. I lost all of the chat, went over. I remember I had one question in private and we had more than 10 questions that we had. So what we can do, either maybe Ala or Abdulaziz, somebody read questions and then we'll answer between me and, oh, perfect. So people who copied and pasted, they can copy and paste again. I think I can start with one of the questions I just received about statistics. So I will start with it. So first couple of slides, statistics is from NRMP data 2021. When do you think time when 2022 data will be out? A great question. So for 2021, 2022 data, I don't know the answer because even I just tried to find the trend on which month they usually publish them. July is a suitable month, but then July for you guys, if you're planning to apply this year, it will be late. Yani getting to know what parameters will be important and what are not by July, because July is the time when ERAS usually opens. But usually July of the year, it's not a must though. So, but I would look for them up into July, and if you, for any reason you couldn't find them, just shoot me an email or message and I'll try to find them for you. But usually July of the year. Secondly, I hear that it is preferred to get more than 10 marks above your step 1 score. However, getting pretty high step 1 score make it difficult to surpass that score. Will it affect if I go below or same across? Kaman, this is a very important question. So what they're asking about, people usually say in step 1, if I get this score, step 2 CK, just to show improvement, it's advisable to get more than 10 scores. So if I get 240, it's advisable in step 2 CK to get 250 and plus. So 2 things. In step 2 CK or in any exam, or always aim, the sky is the limit. So always aim to the highest score that you can ever get. If you don't get it, if your step 1 score was, I would say, above 250, that's really understandable. If you don't improve or you just have 1 to 5 score drop, that's really understandable because 250 is already a high score in step 1. So I don't think that this would count as a bad mark. And subjective interaction with me and an associate program director in internal medicine, he told me the same thing. And in step 1, if it's high, step 2 CK does not have to be higher than that because it's understandable. However, If you get a 250 in step 1 and then you go 230 in step 2 CK, this might be something concerning for the program. On the contrary, if your step 1 score is low, and I will not define low, it depends, and you compare, look at the specialty that you want, because low for ophtha is different than low for internal medicine, then step 2 CK will be the time for you to shine. And this will be really important, because sometimes step 1 score, if it's low, it might close the door for you. The only thing that might interfere and open it, either strong connections or a good step 2 CK score. But then I think, Abdulaziz, feel free to, are you still here with us? And I can't see anything.
Yes, yes, I'm here.
So do you want to take the second question? How long is a reasonable full prep period?
Okay. Again, this depends on two factors. The first factor is the how well. First factor is step 1 preparation. Have you done it or not? Okay. And if you've done it, did you do it well, or just just for a pass? Of course, if you did it well, it's gonna cut the preparation time to much shorter than you'd expect. For example, if you studied for step 1 maybe for like 18 months, for step 2 is gonna be maybe 6 to 8 months if you did step 1 preparation very well. If you haven't prepared for step 1, for example, if you're taking step 2 before step 1, and you're aiming for a reasonably good score, it would take time, of course, because a lot of the concepts are going to be new to you. So you basically you'll be studying step 2 together with some step 1 material. Okay, so it's going to be, of course, it's going to be a longer, duration of preparation. But I would say for most of us here, I think we do the usual route of doing step 1 then step 2. If you do that, I think 6 to 8 months is a reasonable preparation time.
Perfect. And I totally agree. One way just to know, command, if you're done with step 1, so just try to divide the number of questions per the expected amount. I chose 30, and I think 30 is reasonable at the beginning. This will give you an estimation on how long it will take you to finish your step 2 CK. But then try just to add time that if you have any other plans, if you have plenty of time, you want to finish AMBOS, do the same thing. Number of questions divided by the amount that you're planning to do per day. If you're planning to do mistakes and flags, I would say add 700 to 1,000 questions, and then divide them on the number of questions per day that you decided on. But usually the way it's known for, if you're done with step 1, 3 to 6 months. 3, I think that's too tight, because questions of step 2 CKU World are approaching 4,000. And then what does a regular study day look like for step 2 CK? Maybe I can take this. So the good thing about step 2 CK, as Abdulaziz mentioned, you don't have many resources that you need to finish. It's mainly UWorld, and UWorld. If you want to adjunct it with other resources, that's fine. So the regular study day would look like questions of UWorld. So the way I like to do it, again, when I use, this is my routine even after steps. When I wake up in the morning, that's the time that I usually can focus on the most. So I used to try to finish 30 questions without reading the explanation. And then the rest of the day, I would try to read explanations and just try to understand them. This was the regular study day. This is how it looked like, mainly UWorld. So that was a good thing. So preparation usually for step 2 CK, it's, I would say, clearer than step 1, but the exam itself was more challenging. What about you, Abdulaziz? How did you used to study? What does?
Yeah, very similar to your study style. I used to, wake up. The time I did my step 2 CK, I was preparing for it. It was during the beginning of the COVID pandemic, so we had plenty of free time. So I used to wake up in the morning, take my time, do one block. I usually do 40 questions per block. So I used to do 40. Once I'm done with that, I go over them, I revise them. Sometimes I have leftover questions from a previous block that I've done the previous day, but I didn't have the time to revise them. So I revised the questions that have left over from the previous block, and together with the questions that I did on the same day. So usually it takes me 1 hour to solve, and then 3 to 4 hours to revise the block.
Mm-hmm. Yeah, so very similar to each other. One question that I remember that was sent before my Zoom went out: what is MSPE? It's Medical Student Performance Evaluation. So it's just a standard evaluation that's filled by the university, usually the dean, and it mainly evaluates you on preclinical, clinical, and then the clerkship courses that you've taken with a small short paragraph that describes you. If you're at Alfaisal, feel free to reach to us, any one of us. We know the exact process on how to apply for it and who's the responsible person. If you are in another university, it's filled usually by the university admin themselves. So just ask your seniors on what's the process like to get one. But it's usually, this one is usually gotten from the home university. And then the next question, I think mainly Abdulaziz, it's your field, mashallah. How does Step 2 CK compare with SMLE? What is the importance of GPA and grades for IMG after Step 1? So 2 questions.
Okay, so let's take with the first one. How does Step 2 compare to USMLE? They're very different. They're nothing alike, to be honest. Don't think that by doing maybe preparing for SMLE, you will be be able to take Step 2 or the other way around. However, an important point is that the knowledge that you gain from Step 2 will definitely help you during your studying of SMLE, during the studying phase, not the exam itself. The exam itself is very different. The exam itself is based on the previous questions purely. So even if you study for Step 2 CK very well, and you have all the information, and you've got a good score in Step 2 CK, don't expect that will carry over to SMLE, because the exams are not the same. The questions are not written the same way. The information that they ask for in the exam are very different. SMLE, it's very arbitrary. The questions, like you don't know where the questions are coming from or what is the resource that they use to write the questions. However, during the preparation for SMLE, the knowledge that you have from Step 2 will help you in, when you do the previous questions, it will help you in knowing which questions are wrong, which questions are right, which answers to choose, that kind of thing. That's for the first question. For the second question, what is the importance of GPA and grades for IMG after Step 1? I think they are important. However, I'm not sure if program directors, look at them as the way they look at them for AMGs, for American graduates, because for them, for them IMGs, they're coming from schools in a different country with a different system, with different doctors that they never saw. So they will be a little bit skeptical about our grades and our GPA. So they will rely more on their objective tools, which are Step 1 and Step 2.
Mm-hmm. Yeah, I totally agree. Well, just one thing to clarify regarding the same question for wonderful audience from outside of Saudi Arabia. SMLE is the Saudi Medical License Examination. It's pretty close. It evaluates mainly or tests the clinical knowledge, so comparable usually to Step 2 CK as a concept. But when you come to the exam itself, it's really different. And I totally agree with what Abdulaziz has mentioned, that Step 2 CK will definitely help you in SMLE as knowledge. But then if you only plan to pass, I would say I took my SMLE 1 or 2 weeks after Step 2 CK. Alhamdulillah, it went really well, but I studied for the SMLE from previous question banks, let's call them. So if you want only to pass after taking the Step 2 CK, I think you're good to go with the SMLE. You will pass, inshallah. But if you want to get a good score, then for sure you need to open the question banks, because questions are different. And they ask about more detailed stuff. I remember in surgery, they used to ask questions with SMLE about name of techniques, or say that's, in my opinion, is advanced, and that's never discussed in the USMLE. But this would be the thing. Then the other question, اللي هو the same one, Hisham, what's the importance of GPA and grades? So I just quickly went to this slide. I think you guys can see it, صح? I chose internal medicine again. I like internal medicine, and apparently we're matching. It's a blue and I'm wearing blue. So this one has the mean importance. So it's the importance and whom to rank. There are many parameters, and again, it's nice to look at them. So you can see, for example, where was it? Yeah, grades and required clerkships. So they mainly focus on clerkships, which are the clinical years. So at Alfaisal, it's the 4th and 5th year. In the US, it's the 3rd and 4th years. And see, the importance of it is 4. So it's more important than Step 1, a little bit less important than Step 2. And this is, again, for internal medicine. For all specialties, we can go back just to give you a quick idea. Or no, I did not include the slide. Yeah, I did not include it. But the thing is, as Abdulaziz was mentioning, all of these data that we have are for AMGs and IMGs. So the truth is, or it's not the truth, at least anecdotal data from questions that I asked to APD or PD that I happen to meet in the US. For internal medicine, they really, for IMGs, it's not a big concern, the GPA or the grades that they get in each course. However, if you're applying for medicine and then you're consistently failing a course is a question mark. They might, and I know some of my friends who got this question and know, why do you think you failed this course in this year? So failing a course might be a question mark. If you get an A plus, B, A minus or B plus, that's all comparable. Or if your GPA is consistently below a certain level. So for example, if your university is out of 4 and you're consistently below 2, this might be a question mark. But otherwise, it's not the biggest concern for them for IMGs. Next question. What about master the boards and step up to medicine? Are they good? Yeah, to me, Salaha, and resources, I used UWord as a main source and I complemented it with first aid sometimes and divine intervention podcasts when I used to commute to the university. So what do you think, Abdulaziz? So I did not use them, and I know from my seniors, most of them, they did not use them. So what do you think, Abdulaziz?
Used what exactly?
About boards, about master the boards and step up to medicine. Are they good?
I did not use them, to be honest. I don't really have solid information about them.
Mm-hmm. Exactly. Well, the thing is, using books in Step 2 CK is not a common thing. Step CK 2 CK UWord is already really extensive, and the explanation is good. So most of the questions, the concepts might be new to you. That's fine. I remember the beginning of my UWord. The average of each test I used to get was around 40, 50. So that's totally fine if you start this way. But the explanations are extensive. And then the other thing with any step preparation, don't waste your time on using different resources just because somebody else is using them. But what my advice would be, just try to use them for 1 week would not be enough, 2 to 4 weeks. If you like them, maybe refer to them each now and then. This would my advice be.
I agree.
But then the next question is, since the question stems tend to be long and answers more vague, could you share some test-taking strategies? That's a great question in Step 2 CK. So the thing that will help you the most, and just try to read the questions really quickly. I know it's a basic thing. So native speakers tend to read more faster or quicker than non-native speakers. This is obvious. But even for non-native speakers, that's totally fine. You don't have to be a poet to be able to read question stems really fast. But if you can and you improve the skill, this will make a huge difference in Step 2 CK. In Step 1, it will not. In Step 2 CK, it will. If you're that type of a person who reads and try to speak a little bit loudly when they're reading, that's a bad thing. In the examination room, on the examination day, if you're disturbing your neighbors or anybody who's examining next to you, they'll tell you to stop talking, and this might influence your or impact your experience taking the exam. So I would say just try to get rid of this habit if you can. I know it might affect you. The other thing, just try, and my way of doing it, I used to, if you double click on the mouse, it will highlight in yellow in the exam day or even UWord. So I used to highlight the important things, and important things includes both positives and negatives. So for example, if I started thinking about a patient with HIV, a very important thing, immunization history. So it will be negative. This is important. If it's positive, again, this is important. So highlight not the full line, just single words that I can refer to at the end of the day or at the end of the question, I mean. And then the other thing, excluding. So questions are big. Solving by exclusion, that's a well-known technique, but for Step 2 CK, it's even more important. If there's something that is wrong, just exclude it. You might end up with an answer that it's not familiar to you whatsoever. If all the other answers you are excluding, you're confident that they're wrong, just choose the answer that you don't know about. If the others, you're confident that they're not correct. If you're in doubt between an answer, or at least this is what I used to do. If I'm in doubt between two answers, one of them I know about and I can partially explain why it's the answer, whereas the other one I don't know about whatsoever, I would go with the one that I can partially explain why it might be the answer. This is what I used to do. So these are the, trying to read quickly, highlight the key important stuff, and then work by exclusion. I know it's a vague exam. Yeah, Abdulaziz.
I used similar techniques to what you said. Also, maybe this needs more practice. So maybe try to do it while you're doing UWorld. Try to read the end of the question. It worked for me a lot. So I used to read maybe the last two sentences of the question to give me a very good insight of what the question is asking about. Then I would go to the answers. I would skim over the answers, and then just by doing that, I have an answer in mind. And most of the time, that answer that I have in mind will be confirmed when I read the question very quickly. So this can save you time. One more thing, look, if you have a picture or a diagram in your exam, look at that as well at the beginning of the question. So you know what, like for example, if you have a microbiology picture, look at the picture. See, is it a virus? Is it a bacteria? Is it a fungus? So look at that. Also, although this might be helpful sometimes, but in step 2 CK, they give you the normal values, but before the exam, I used to just go over the normal values of like CBC and normal values, because as to not to waste time to looking at the normal range that they give in the exam. So once I look at the number, I know if it's normal or abnormal, because I already memorized it before, and this can save a bit of time.
Yeah, no, especially the last trick is very important. يعني when you know sodium is 135 to 150, خلاص, you know it, and it's really common, and you'll see sodium for sure in the day of the exam. Again, it's not sitting and trying to memorize and the sodium is 130. So, no,
yeah,
it's
exactly.
with practice. You have 4,000 questions. Each time you look at sodium, by the end of 500 questions, you'll remember what sodium value is. For students at Alfaisal, just try to make it, or even at other universities, if you have PBLs, other clinical discussion, just try, sometimes if you happen to come across sodium, ask your friend next to you, and do you know what's the normal level of sodium is? Because the big ones, and for me until this day, magnesium, I have problems remembering it. But sodium, potassium, it's really a common sense now. Creatinine, BUN, these are common sense. So these are important stuff. Yeah, and this really would save you time. Regarding next question, regarding duration for the exam preparation in case of 6 to 8 months, how many hours per day on average? What do you think, Abdulaziz?
I would say at the beginning it used to be maybe like 3 to 4 hours, and towards the end it would be more, of course, because you're trying to wrap up and revise. So probably 6 to 8 hours at the end, maybe the last month or something.
Mm-hmm. Yeah, I agree. I think Abdulaziz is better than me in answering these questions. MashaAllah, he can sit and focus. And to me, I never know how long did it take me in whatever step we're talking about. I do 1 hour in the morning trying to finish solving questions. Then throughout the day, I take them in chunks. So sometimes I finish 10 questions and then go for a break. Then another time, 5 questions, reading the explanation, I mean. So it's really difficult for me to estimate, but I think Abdulaziz, what mentioned sounds really reasonable. Next question about NRMP, how can we meet the interpersonal skills and professionalism? That's great, and this is really important. I think it used to be more important when people used to have in-person interviews. So this would evaluate you on this thing in 2 settings. Either if you did a clinical elective at the department where faculty used to directly interact with you, faculty, residents, and medical staff, or during the interview. So during the interview, when it used to be in person, it was really easy for them to know, and even for you to know the toxic environment or friendly people. Now, when it's virtual, it's really difficult, but it shows. I always had this question, will I be able to know as an applicant? But it's really obvious. Not evaluating the faculty, and even evaluating not evaluating, but looking on how other people would interact. Some people would be really nice. So I remember in one of my interviews, one of the applicants at the end sent me on Zoom a message just saying, good luck with the rest of your interviews. And it was literally the first time that I've seen him, but we just got to talk for 5 seconds during the interview. So it shows that this person is a very, very nice and respectful person. And likewise, during the full day, because you'll be interacting during the interview one-to-one with the program director or associate program director or other medical staff, it shows whether you're trying to listen, you're interrupting their questions, you're using a polite language to answer, whether you're speaking. It shows when you try to lie, whether you got a question about not a clinical case, but anything that they might ask you about. It sometimes show whether you're lying about it or you're giving the truth. So that's how they would decide. Most people, I think, would do fine, but people who I would say have odd way of thinking, or maybe they really don't care, it might show during the virtual interviews. And this will negatively affect, and this would be a decisive factor whether they'll rank you or not, the interpersonal skills and professionalism. Then for students taking step 2 CK before step 1, is there any modifications to the study approach that you recommend? Do you recommend using Sketchy, Pharma Micro, or other step 1 resources to do or to supplement your work? What do you think?
Yeah, you can do that. I think it will be helpful, especially for Pharma and Micro, which are important in step 2 as well. Yeah, you might do that. It can save you time, and they're very nice resources. They simplify things. So, but it might add to your preparation time.
100%. I would say also, I know both of us seemed like do step 1 before step 2 CK, and I still stand by my word. But even if you're taking step 2 CK, that's totally fine. Don't panic. We'll just try to assess how you're improving in UWorld. So don't use UWorld as an assessment tool, as Abdulaziz was saying, but look at your performance. Are you improving? If you started 40 and you're still 40, that might be, there's something wrong. If you started 40 and you're reaching to 50, 60, that's perfect. You're improving. So based on that, you'll decide. And in step 2 CK, I did not interrupt my UWorld, but in step 1, I was lacking behind in psychiatry and ethics. So I stopped UWorld, and for psychiatry, I used the RX video for psychiatry. For ethics, I solved some questions on ethics, and then I went back. So just try to see if you're lacking behind in one of the fields or concepts, stop or do them in parallel when you're preparing for UWorld. I think this might help if you haven't done step 1 yet. What is your opinion on boards and beyond step 2? What do you think, Abdulaziz?
I haven't used it, to be honest, for step 2. For step 1, I use it for physiology, for like renal physiology, respiratory physiology, cardiophysiology. But for step 2, I haven't used it, so I'm not really sure. I've used online meded for Epigyne, but I'm not sure about boards and beyond, to be honest.
Yeah, so exactly, I'm on the exact same shoe. I did not use it neither for step 1 or step 2 CK. I know from my friends and colleagues, it really helps you if you have a concept that you do not understand. The downside of boards and beyond, I haven't used them, but this is what I hear. They're long, they're not that short of videos, and they're series. So if you start with cardiology, you need some time to finish all cardiology concepts. So this will take time. Yes. And as medical students, we don't have all the time in the ward. That's one. And then the second thing, especially if you understand this concept, I don't see a point of doing boards and beyond if you think that you're doing okay in this subject or in this field. If you don't, stop and study for them. And it's funny that I too used the med-edit for OBGYN. It's the only subject that I use other videos for, but it was Salaha great. Yes. But boards and beyond, I haven't used it. Students from my friends and colleagues who used them for step 1, they were satisfied, but it takes time. Would you provide a recording of this session? I think this question goes to the IO, but I think, mashallah, they're doing a great job of recording everything. I think this one was being recorded, and I think yeah, exactly. And I know, mashallah alayhum, for the previous sessions, they did publish everything on YouTube. So I think these are recorded, and these will be, inshallah, posted on YouTube. Then
we'll be basically every time we'll be recording it, but it just depends on whether the doctors give us permission to publish and other things. So inshallah, when it's recorded and if it's on YouTube, we'll email the participants and they'll know, inshallah.
Perfect. And I would advise also, Luqman, if you can post it on social media, and not all of, or you guys are taking the emails of everyone, not only your face of people. So that's great. Perfect.
Sure. Okay. Inshallah.
Inshallah. Then, what is the most predictive self-assessment for step 2? And is AMBOS, the question went away. And is AMBOS self-assessment good? What's the most predictive? I think your self-assessment 1 and 2 were the most predictive for me. And not only for me, even if you read on Reddit, ask my colleagues and friends, and Hala will get the opinion of Abdulaziz. So I think everyone agrees, or majority agree, that your self-assessment 1 and 2. AMBOS, is it a good self-assessment? I haven't used it, so I really don't know. What do you think, Abdulaziz?
Yeah, I agree. UWorld assessments are usually the most predictive. I think for me, I think 2 was even more predictive than 1, and the same thing was for step 1. Self-assessment 2 was more predictive than self-assessment 1, and the AMBOS assessment, again, I did not use it. Same thing, so I don't know about it, to be honest.
Mm-hmm. Yeah.
Maybe you can go on Reddit and read some threads. Maybe they can give you an insight about this.
Yeah, 100%. what is the MSPE and how do you get it? It stands for Medical Student Performance Evaluation. So at Alfaisal, there's a process. You can ask us, which person to go to. The year that you apply for residency, you will have everything ready, step 1, step 2, and other things, maybe OET if it still is required for your application. But then you'll apply through the dean office, and they will issue it for each student participating in the match. So this is how they do it. What is it all about? It's performance evaluation. So they write comments about you, preclinical, clinical, and then preclinical, pre-clerkship, basic, preclinical, and clinical, the 3 phases at Alfaisal. They write the comments about that, and then pages of clerkship years, they'll put your score in the block or rotation, and then they write a short paragraph describing your performance. It's mainly important for AMGs, way more than IMGs, but it is a requirement. You can't apply for the match without the MSPE. For other universities, I think it's best to ask your seniors on what's the process of getting it, but that's how usually it is. There's a comment just to add to the person who asked if whether they should study sketchy pharma and micro for step 2 CK if they haven't done step 1. I highly recommend doing Anki for pharma and microbiology. Perfect. So I say perfect too often, but no, they're suggesting that using Anki for pharma and micro would be helpful. For me, in step 1, I used sketchy micro only, and I really liked it. I did not use pharma because I did not like it.
Same thing.
I see we're matching in almost everything. What is step 3 and how important it is, and how does it relate with step 2 CK knowledge? So step 3 is the exam that you take after finishing step 2 CK. And not only that, you have to be a graduate to be able to apply, and you have to be ECFMG certified. So you're done with step 2 CK, you graduate, then you have to apply to ECFMG certification. After that, you'll be eligible to apply. How important it is for residency, it's not required. It's as we saw, I think at the beginning, for all specialties, only 3% of the programs required a score. And I'm not sure how this is possible because almost all AMGs will not take it by that time. Usually, it's a requirement to transition from first year residency in the US to second year. So usually, most of the programs, if not all, require that you pass the test, the step 3, before you go from first year to second year of residency. So it's not required for your application. How important it is, you have to pass. If you don't pass, that might be a red flag. But once you pass, the score is not that important. I would say the most important thing that would care about the score of step 3 is internal medicine, surgery, and urology. It's not as important, but even in internal medicine, it's not heavily regarded. So fun fact, even step 1 and step 2 CK for internal medicine fellowship matching, future inshallah cardiology, hematology, oncology, GI, and so on and so forth, they value step 1 and step 2 CK score for fellowship matching more than step 3. But they will look at your step 3. So if you score, let's say 250, 260 in your steps 1 and 2, and then you barely pass at 200 in step 3, this might be a question mark. But if you just pass even average to 22, 30, this should be fine. But then we have next question is, do you think it's possible for people with step 1 pass to apply for match 2023 and get a good number of interviews, or it's better to wait until 2024 when everyone will have pass? That's a great question, and nobody would know. I will give you my 2 cents based on my personal opinion and what I'm hearing from my seniors, social media, Twitter, and so on and so forth. If you're done, I would definitely say apply. Nothing restricts you from applying. I know it might be a little bit tricky, although objectively speaking, most AMGs will have a numerical score in 2023 in 2023 match. So it will be a bit tricky for program directors to know if I'm comparing between somebody who's passed as an IMG and the other one who's in their 240 and 250. I can guarantee that 240, 250 excelled the exam, but I don't know anything about the one who passed. So it might be a little bit tricky. It might negatively affect people who did it as pass or fail. But I would, if I were in your shoe, I would definitely apply. I will mainly focus on step 2 CK exam. Because as we were saying, if you're planning to apply for internal medicine, then step 2 CK already is more important. If you're not applying, if you're planning to apply for other residents or other specialties, then step 2 CK will be really important if you get a good score. لأنه I assume that this would be the main filter, at least even if they're comparing you only with IMGs with pass, you will still be on the top of the list if your step 2 CK score is great. And then the other things that are really important, and nobody will focus on them during this talk, or nobody focused on them because it was mainly about steps, step 2 CK. And if you have electives, good letters of recommendation, good connections, for sure, inshallah, this will give you an interview, even if you have a very low step 1 score. But you're asking about pass and fail, so. But then we have another question. Are the UWOD questions more reflective of real exam than MBMEs?
Yes.
Is it also true for step 1? What do you think, Abdulaziz?
ولا يهمك ابو صالح ولا يهمك. I think UWOD questions are they're very representative of the exam, to be honest, in terms of length, in terms of how the question is written, in terms of the answer they give you, how close they are to each other. MBMEs, usually they have shorter questions, not enough clues. The exam usually they give you a lot of clues, sometimes more clues than you need. So in terms of similarity to the exam, I think UWOD is more similar to the exam. What do you think, Mohamad?
Yeah, no, I totally agree. يعني MBMEs, as you were saying, that's why I did not need to comment. I totally agree. I only did one MBME, and it was just because it was free at that time.
Yes,
so
yes,
I think that was the only reason, because I had it for free. So I thought I might do it as well, but it was not reflected. It's nice. You'll have a good feeling, I think. Questions are too short. You'll get a good score. But when it comes to the reality, that's not how your self-assessment 1 and 2 are, and that's not how the real exam is. So don't waste your time and money on MBMEs. But I'm not sure for step 1 there are new MBMEs. So if it is the case for MBME for step 2 CK, then both of us don't know. I know the last MBME was 7 or 8. If there are new MBMEs, they might be more accurate, more reflective. So double check maybe Reddit or other social media. And they asked also, is it also true for step 1? For step 1, MBMEs were more helpful. What do you think?
Yes.
Yeah.
Especially not the new ones, though. Not from 20 to, I think now they're up to 30, I think.
Exactly.
Yeah. But on our time, we used to have until 24. So from 20 to 24, they were not very helpful, to be honest. Maybe like 18 and below, 18, 17, 16. These were good, I think. They give you very good practice. The questions, the concepts they ask in the questions are very important concepts that you need to know. So, yeah.
And just quick announcement I thought of saying, because some of us here are non-Arabic speakers. So Abdulaziz and I started laughing not on the question. We just started laughing because we called each other by our nicknames, because we're very good friends. So that's why we were trying to formally call each other with Mohamad and Abdulaziz throughout the session. So that's why we started to laugh at the end. I think these are the questions that I have. I don't know whether, Abdulaziz, you have any other questions, or if we happen to miss any questions.
I don't have any questions. I think, that's it.
So you're most welcome. Any other question that you guys might have?
Thank you so much, everyone, for listening and for attending this talk. Attending this talk means that you care and that you really want to benefit yourself. Inshallah, we were able to do that. I hope so.
Yeah, and it's really nice seeing you guys interacting and asking questions, because I know some of you maybe have not even started preparing, but this is what it takes to succeed in life. Try to ask questions, hear feedback, and then gradually start to plan for whatever step you're planning to take, whether it's a USMLE step or any other step in life that you guys are planning to take. And that's alhamdulillah, one of the helpful things that we have at Alfaisal. I know this is what we're doing now, is what we received when we were students in first year through internship, because everyone was so supportive and helpful. So we're just trying to be as nice as everyone was. I think we have another question, and then I just remember one thing quickly that I wanted to announce. one thing for answering Nawaf's question, for Step 2 CK, command for people, I remember this question all of a sudden when I was doing something, and I thought of searching about it. So for Step 2 CK, obviously for people who are applying to the US, this will be helpful. But for other places, it is helpful. So for people, it's equivalent if you want to apply for residency in Qatar. Step 2 CK is equivalent. You don't have to take any other medical test. This would be enough. And it's important. So if you get a high score, chances are you might get a good residency. And we have many examples of our close friends and colleagues who went to Qatar in different specialties, mashallah, including ophthalmology, with their Step 2 CK scores. The other thing is the AUB in Lebanon. So Kaman, you can use your Step 2 CK score to apply for that. And no, they don't require Step 1. It's mainly Step 2 CK. There are other paths. They're not as clear. So New Zealand, Ireland, and the UK, but it's not only about Step 2 CK. So UK, Step 2 CK. So UK, it's not only this exam, multiple of exams, I think, including Step 2 CS, which we don't have anymore. So it's for previous graduates who already taken this exam. For Ireland and New Zealand, the Step 2 CK might help you in applying in certain aspects. I'm not sure about them. But Qatar and AUB, you can apply with your Step 2 CK. Is obtaining a visa and sponsorship hard? A great question for Step 2 CK. I think, as you may know, you can take it anywhere in the world. So the answer is no. But if you're asking about residency in general, two parts to answer the question. The first question, I would advise you, if you're still preparing for your exams, don't think about them. That's too early. Even if you finish your exams, finishing STEPS exams will help you not only to apply for residency, but honestly to organize your thought process. Other exams will be easier. And the way you interact with any medical discussion will be way better than before you finish your STEP exams. So it's always a good idea to prepare for the STEPs, even if you're not planning to apply to the US. I assume that everyone in this session is planning to, but even if you're not, this will help you in whatever path you plan to choose, even if it was academic but non-clinical related. But the second, or to answer your question directly, is obtaining a visa and sponsorship. It's a long answer, but the short story, if you get a residency spot, then most likely it is doable, but it's more administrative issues by the embassy and so on and so forth, but it is doable. And most people will have no problems getting a visa, unless there is something else is going. So is taking USMLE exams and scores a factor for Saudi residency? Abdulaziz, it's all yours.
It's a very tricky question, and I really do like this question. It's very hard to answer, and because the truth hurts when it comes to answering this question. But to put it simply, no, they will not help. That's all I can say.
This is what we all agree on. They will not help. But the other part of the question, I don't know. You're all most welcome. It was really nice getting the chance to interact with each one of you and to get to speak with Abdulaziz.
Thank you so much. Thank you. Wow. It was a very...
So thank you, everyone. You guys have our emails, I think. You're more than welcome to contact us if you happen to have any question. So there's a second part.
Okay, yeah. So you know the answer then for the question.
It may.
Yeah.
So, yeah, I think by that we're coming to an end. Thank you, everyone, for whoever who attended. And thanks for Luqman and his team, the International Office and the MSA, for this great session. Assalamu alaikum.
Thank you so much, everyone. Thank you.
Thank you so much, doctors. It was indeed very beneficial. We all loved the presentation. We truly value your experience and guidance. I'd also like to thank AMBOSS for their constant support in helping students secure their careers. To everyone in the audience, we thank you for joining us today, and our team hopes that you found this session as informative as we did.